Hi, I'm Sterrenberg. I'm a fellowship-trained orthopedic surgeon with specialized training in hip and knee replacements. In this short video, we'll cover the details of your upcoming surgery, including surgical anatomy and implant materials, as well as what to expect postoperatively. First, we'll cover hip replacement surgery. The hip is a ball and socket joint composed of the femoral head and neck, an acetabulum or hip socket. For hip replacement surgery, an anterior approach is utilized to access the joint through the front of the hip. This is accomplished by going in between muscles. The femoral head is removed and replaced with the ceramic or metal head, and this is attached to a titanium stem that is press-fitted into the femoral canal. The acetabular cup or hip socket is prepared by removing the labrum and reaming away any damaged cartilage and bone. A titanium shell is then press-fit and screwed into place. Finally, a polyethylene or plastic liner is impacted into the shell and the hip is reduced to allow for immediate weight bearing. All implants are placed under intraoperative imaging to allow for accurate alignment. The cup is titanium and has a surface 3D printing that mimics the architecture of human cancellous bone to allow for bony ingrowth. The stem is also titanium. The ceramic head articulates with a vitamin E stabilized polyethylene liner and is designed to last over 30 years. Next, we'll cover knee replacement surgery. The knee joint is composed of the femur, tibia, and patella, or kneecap, and is stabilized by 4 ligaments. The MCL and LCL, or medial and lateral collateral ligaments, stabilize the knee from medial and lateral forces. The ACL and PCL, known as the anterior cruciate and posterior cruciate ligament, stabilize the knee from anterior and posterior forces. Knee replacement surgery is performed through a standard medial parapatellar approach, which is used to gain access to the joint. The ACL is routinely removed. About 8 to 9 millimeters of bone is resected from the tibia, femur, and patella, which allows for components that can be either cemented or press-fit into place. A polyethylene insert is placed between the femoral and tibial components and is designed to substitute the function of the ACL and PCL. The femur is typically made of a cobalt, chromium, and nickel metal, but for patients with metal hypersensitivities, a stabilized titanium metal can be used. The tibia is made out of titanium, and the patella component is made out of polyethylene. The poly insert is a vitamin E stabilized, ultra-high molecular weight polyethylene that is designed to last over 30 years. Next, we will talk about what to expect following surgery. The procedure time typically takes about 2 hours, and most patients are able to discharge home the same day after working with physical therapy. In terms of pain control, local anesthetic or numbing medication and nerve blocks are used, which can provide pain relief for up to about 48 hours, which is when the pain is most severe. Oral pain medication can be used thereafter. Pain and swelling is normal for the first week after surgery and should be expected. For mobility, use of a walker is required for 2 weeks after surgery to prevent any stumbles or falls. Activity should include 5-minute walks every 2 hours. Elevation and compression stockings can help with leg swelling. For knee replacement surgery, it's important to regularly work on knee range of motion at home and with your physical therapist during the first 2 weeks after surgery. Post-op medications are prescribed the Friday before surgery to allow for early pickup or pickup on the same day of surgery. Detailed instructions are printed out for you regarding the dose and timing of medications. We are not able to refill medications on the weekends, and driving is not permitted while using narcotic pain medication. Wound and dressing instructions are provided, but specifically, the incision will be covered with a sterile waterproof dressing, which should remain in place for the first 2 weeks or until clinic follow-up. For knee replacements, the ACE wrap should be removed 24 hours after surgery, and the dressing underneath should remain in place. For bathing, the dressing is waterproof, and showering with soap and water over the dressing is okay. You should avoid soaking or submerging the wound for the first 6 weeks or until released by your surgeon. Reasons to call and notify the clinic include expanding redness around the wound concerning for infection, drainage that does not stop after the first 48 hours, or continued fevers that last more than 6 hours and are not controlled with Tylenol. For follow-up, your first visit is typically with the physical therapist. This occurs 1 week after surgery. Following this, your next appointment will be at the 2-week mark for a wound check. I will see you again in clinic at 6 weeks for x-rays and then routine clinic follow-ups occur at 3 months, 6 months, and 1 year. Thank you again for choosing Christus St. Vincent.